So we have representatives from 3 regions of the Africa Union, and that is the Southern Africa region, the Eastern Africa region, and some representative from the Northern Africa region. So the main objective of this regional capacity building workshop is to share experiences among countries and also to build the capacity of the Africa Union member states to be able to address some of the gaps which still exist in the community health field on the continent. Recently, Africa CDC and partners conducted a survey to determine the landscape of community health on the continent. So in that survey, we realized there are a number of gaps that still exist. For instance, there were 42 countries that responded to that survey. Out of those 42 countries, up to 18% of the countries still don't have the community health strategic plan. And for the countries that do have the community health strategic plan, only 55% of those member states have costed their strategic plans. We also still have major gaps when it comes to investment cases in community health. For a long time, community health has been perceived as an expenditure. That community health does not bring any added value economically on the public health. But recently studies shows that community health is a smart investment. And in this workshop, we are going to see the return on investment when implementing community health initiatives. Then lastly, even in this digital era, about 71% of our countries are still using paper-based data management for community health. So in this workshop, we are going to discuss about the different approaches and the innovations that we can use in order to transform our community health into digital system. Thank you so much.
Community health actually is very important. It is the foundation of our health system. Currently, as we are looking at achieving SDGs and the UHC, community-based primary health care has been found to the best method, which will increase access, availability, and quality health services to the people at the grassroots. It has also been shown it is the most cost-effective in terms of using resources and putting services in a manner that are comprehensive and integrated. It makes use or most use of the resources that have been attained. So this in the long run will help us in achieving universal health coverage nationally, but also regionally and in the continent of Africa. Thank you. Yeah, issues of capacity building actually are continuous because we know that new health workers come into the field of health. We know there is high turnover. There are those people who move out. We know that there are some areas where this capacity is not really there. More importantly, using evidence-based information that this capacity is needed. For example, in this workshop, it has been shown that 18% actually of our member states do not have community health strategies, so it is important for them to be given the skills and competence to do the same. It has been shown that 45% of these member states that have these strategies are not costed. So this forum is also capacity building people in costing of community health strategies. It has also been shown that about 71% of the member states actually do not have digitalized community health information system. So this will be important forum for them to be given this capacity so that they can have the skills and competence to do the same. Data management is also an issue which will be looked at this. And we know with the data there is better planning, there's better implementation, and also better use of resources.